Well, for the second time this year, 15,000 nurses across the state say that they are prepared to walk off the job.
The nurses voting to go on strike in 10 days, and this time, instead of 3 days, they plan on 3 weeks. Rob Olson joins us live from Children's in Minneapolis. So, Rob, lots of reaction to this strike vote today.
Yeah, and Children's Hospital here is saying, there's never a good time for a nurses' strike, certainly, but this, they say, couldn't come at a worse time because of the rising number of cases of RSV and influenza. Even COVID is starting to make a little bit of a comeback as well. Of course, that could be part of the leverage for the nurses, but both sides saying that they really, really hope that in the next 10 days it can be averted.
I think we can all agree this is the worst possible time for the union to call for a strike that would pull nurses away from the bedside.
The dire warning from both Children's Minnesota and Masonic Children's Hospitals.
The surge that we're seeing now, I've never seen in my 20-plus years of working in pediatrics.
Seemed a very direct appeal to the nurses who plan to return to picketing on December 11th. That as RSV cases are spiking now, the impact on critically ill kids could be massive.
The reality is that in a setting of a work stoppage, the critically ill children in particular will need to be transferred to other hospitals outside of Minnesota to neighboring states.
In announcing their intent to strike again following the 3-day strike in September, nurses also acknowledged the current surge from both RSV and influenza, but say those have only worsened their own crises of low staffing and nurses leaving.
Every night you have to struggle to make assignments because there aren't enough nurses. We barely have experienced nurses, and our patients are at risk.
Hospitals, though, are now scrambling to line up replacements. The governor says they're in constant contact.
We're monitoring it closely. We know this is a big one because it involves the University of Minnesota, the teaching hospital. There's a lot of interactions here to make this work.
But at Children's, for example, 1,000 nurses will walk out. And at this point, they have just over 300 traveling nurses to take their place.
In the coming 10 days, a hospital will only be able to staff 33 ICU beds. Currently, we have 62 under our care.
Yeah, so they said they've been making preparations to bring in nurses and move patients out of state. The CEO of Children's here is saying they actually had negotiations going on again today, and they'd been asking for mediation. They got a mediator standing by to help try to resolve these issues. But again, though they say they've come a long way in 9 months at closing the gaps, those gaps are still there in terms of pay, in terms of staffing, in terms of safety, and they at this point feel they've been at a critical impasse. Live in Minneapolis, Rob Olson, Fox 9.
Well,